right, hello everyone. Welcome to our recorded CME session where we will be reviewing the Medicare Annual Wellness Visit. My name is Rebecca Masutani. I am an assistant professor at Mount Sinai, and I'm also a geriatric medicine primary care physician who does quite a bit of Medicare Annual Wellness Visits for my patients. So I'm very happy to discuss with you all about this topic today. So in terms of a few keywords, these are just some keywords I have listed associated with this particular presentation. I do not have any disclosures today. And in terms of objectives, so during this session, my goal is to review the required elements needed to complete the Medicare Annual Wellness Visit. My hope is to also identify ways to incorporate the Medicare Annual Wellness Visit into ambulatory practices. And I also will plan on reviewing some billing codes as well for the Medicare Annual Wellness Visit. So let's start off with the basics of what the Medicare Annual Wellness Visit is. So in short, Medicare Part B covers a yearly annual wellness visit for Medicare beneficiaries, i.e. patients who have Medicare as their primary insurance. And this is covered on a yearly basis, that is every calendar year. The Medicare Annual Wellness Visit is comprised of a health risk assessment, and this includes things like routine measurements, like the taking or capturing rather of vital signs. It includes specialized medical advice for the patient, a review of the patient's medical family history, as well as review of their current medication list. And if pertinent to that particular patient case, it can also include advanced care planning, as well as a checklist for appropriate preventive services, and also do a review of the social determinants of health as well for that patient. The Medicare Annual Wellness Visit also includes a brief cognitive assessment for patients. What I will note here is that this cognitive assessment is different from the cognitive assessment and care plan service that is also covered by Medicare and is a different E&M service. So we'll talk a little bit about that in a few slides when we review billing. And lastly, the Medicare Annual Wellness Visit also includes a review of a patient's substance use and/or opioid use risk factors. I'm going to stop here and pause for a little bit. And I want to also take some time to review what the Medicare Annual Wellness Visit is not. So the yearly annual wellness visit is not a physical exam, which is generally not covered by Medicare. And the yearly annual wellness visit is not the Welcome to Medicare visit that occurs within 12 months of a Medicare beneficiary's Part B enrollment. And we'll talk about this in the next slide. So this graphic here is taken directly from the CMS Medicare Learning Matters website. And essentially it outlines the differences between the initial preventive physical exam, the annual wellness visit, which is circled here in red, and routine physical exams. And in short, the initial preventive physical exam, which I may refer to as IPPE moving forward in this presentation, that is a visit that occurs for patients who are new to Medicare and takes place within 12 months of patients enrolling into Medicare Part B. The annual wellness visit, on the other hand, again circled here in red, occurs after that time. And as I mentioned previously, it is covered every 12 months. What I'll also add here is that for both the initial preventive physical exam and annual wellness visit, patients with Medicare may not have to pay any cost-sharing amount, that is a copay or coinsurance, if the provider accepts Medicare assignment, meaning that there is an agreement between the healthcare provider and Medicare, whereby the healthcare provider accepts Medicare, the Medicare approved amount for that covered service as full payment. So with all of that said, keep in mind that the no co-sharing amount only applies again if one, the provider accepts assignment, and two, If all that's being provided during that particular visit encounter is either the initial preventive physical exam, the IPPE, or the annual wellness visit. I say this because if any other chronic conditions are addressed during the visit outside of the IPPE or annual wellness visit, providers can concurrently bill for an office visit, as an example, a return visit or established visit, in addition to the IPPE or annual wellness visit. And in those cases, patients may be subject to a cost-sharing amount. So we'll talk about billing in a few slides. As displayed on this slide here, this is the initial preventive physical exam requirement or welcome to Medicare requirements. In short, this is very similar to what is required in the subsequent yearly Medicare annual wellness visit. So I'll take some time to review this in detail. And again, keep in mind that the term physical exam is a little misleading since, like I said earlier, Medicare generally does not cover routine physical exams. So in terms of the first covered component within the IPPE, providers are required to complete a health risk assessment. This is generally a self-reported questionnaire that patients can complete, for example, if they're in the waiting room before they see the healthcare provider, or even electronically in some cases where practice have access to an electronic medical record system and secure patient portal. And the hope is that the patient completes this within 20 minutes or less, and that the questionnaire is appropriately tailored to and considers the communication needs of different patient populations. Very specifically, the health risk assessment at minimum should address the following information. So it should address demographic data, a patient's self-assessment of their own health status, their psychosocial and behavioral risks, as well as the patient's ability to perform ADLs and IADLs. And certainly the health risk assessment questionnaire can be completed by the patient's caregiver if the patient themselves are not able to complete this. The IPPE should also include a review of the patient's past medical history, including their recent hospitalizations, any medical events that have taken place that can place the patients at higher risk of a particular condition, and also a review of medications, that is, use or exposure to various supplements as well. Additional requirements for the IPPE includes listing current providers that the patient is seeing, as well as suppliers. So for example, durable medical equipment suppliers. It also includes obtaining a standard set of vitals for the patient. So in this example, measuring the weight and blood pressure for the patient. This is fairly self-explanatory, though I will note here that if the Medicare annual wellness visit is completed via a telehealth visit, practices can ask their patients to self-report their weight and blood pressure if they are able to do this. And if patients are not able to self-report this and the Medicare annual wellness visit or IPPE is being done via a telehealth service, then this should be clearly documented in the note. The IPPE and also annual wellness visit should also include a cognitive assessment, which is defined as direct observation, consideration of information obtained by the patient or caregiver, and this can include patient reports or concerns raised by people around the patient. Keep in mind here that for this requirement, this cognitive assessment requirement within the IPPE or annual wellness visit criteria, there is no specific screening or assessment test that is mandated here. And again, keep in mind that this assessment is generally considered to be a brief assessment of an individual's cognitive function. and is different from the comprehensive cognitive assessment and care plan service that is associated with the code 99483. The latter is a much more involved service than this brief cognitive screening assessment required in this Medicare IPPE or annual wellness visit. The IPPE or annual wellness visit should also include depression screening as well as reviewing risk factors for depression in patients. It should also include a functional assessment, so at minimum, reviewing a patient's hearing impairments or risk of hearing impairments, their fall risk, home safety, and ability to perform ADLs, IEDLs, which I think I mentioned on a previous slide. It should also include a personal preventive plan, and essentially this is a written screening checklist or schedule for patients, generally based off the U.S. Preventive Services Task Force and Advisory Committee on Immunization Practice guidelines. So examples of this include sharing of information with the patient on when to get the shingles vaccine based on their vaccine history. Another example of this is sharing with the patient if a colonoscopy is needed and when a colonoscopy is needed based on their age and risk factors. Similar to what we discussed previously, the purpose of these Medicare annual wellness visit is to offer personalized wellness advice. And this usually involves health education, preventive counseling services, and community-based lifestyle interventions focused on subjects like weight loss, decreasing fall risk, increasing physical activity, among many other things. And again, this is all specific to that patient in front of the healthcare professional. And certainly this is at the discretion of the Medicare beneficiary, i.e. the patient. So if this is pertinent to the patient's case, healthcare providers can also include advanced care planning discussions during the annual wellness visit. So namely, these discussions can be about future care decisions, a decision on current care preferences, and a discussion and or explanation of advanced care directives, which may or may not involve the completion of advanced care directive forms. If patients are currently prescribed opioids, providers should also review the following. So providers should review risk factors of opioid use disorder. Providers should evaluate the patient's severity of pain and treatment plan. They should also provide information on non-opioid treatment options and refer to specialists like pain specialists, for example, as deemed appropriate. And lastly, it's important to screen all patients during the annual wellness visit for substance use disorders. And as I mentioned previously in the opioid use disorder screen slide, to have providers place referral for specialists as appropriate. So while there's a lot of information to complete during an annual wellness visit and review, the benefits of completing this with your patient is that it allows time to counsel patients on prevention and safety, and it also incorporates a lot of geriatric principles, like the 4Ms, into the visit. And lastly, we'll talk about this in a few slides, it does offer an opportunity for practices to be reimbursed for aspects of good geriatrics care. With respect to subsequent annual wellness visits, there are regulations that providers must follow. And since we covered a lot of ground in prior slides about what's needed for the initial preventive physical exam, the main thing to note here for subsequent annual wellness visits is that the expectation is to really review and update what had been discussed previously. And to emphasize again, federal regulations define a subsequent annual wellness visit as one that takes place 12 months after an individual's effective Medicare Part B coverage date, and one that occurs more than 12 months after an individual's initial annual wellness visit. And as you can see here, many of the requirements are very similar to the initial annual wellness visit requirements. So I'm going to make a brief comment here about annual wellness visits and telemedicine. That is, during the COVID-19 public health emergency, CMS expanded coverage, Medicare coverage of telehealth services. And the main comment that I want to make here is that for the time being, Medicare annual wellness visits, like other Medicare covered services or encounters, can be completed via telehealth and generally covered by Medicare Part B throughout 2025. Additionally, if there are certain physical exam components, like determining a patient's weight or blood pressure, and they cannot be completed during the telehealth visit, this needs to be documented clearly in the provider's note. So now that we've discussed the requirements for Medicare annual wellness visits, I wanted to briefly take this time to review billing or CPT codes that may apply to providers who are conducting annual wellness visits in their practice. So to orient you, the table outlined on this slide lists the CPT codes for the respective service provided to patients, the work RVU associated with these codes, and the national non-facility Medicare price for each service. Keep in mind that these values were obtained in August 2025 and subject to change. Also note that this table is not inclusive of all the E&M visits you can possibly combine with the Medicare Annual Wellness Visit CPT codes. And although our talk has primarily focused so far on the annual wellness visit, I did include some codes on this table for advanced care planning, which we've discussed again is an optional component of the Medicare annual wellness visit. And I've also included the 99483 code, the Cognitive Assessment Management Care Plan code in the bottom row as well, which is different again from the brief cognitive assessment required for the Medicare annual wellness visit. So let's take a look at row 1, the G0438 code for the initial annual wellness visit, also known as the Initial Personalized Prevention Plan or Initial Personalized Physical Exam. So the RVU associated with this initial Medicare annual wellness visit is 2.60. And you can see here that at the time of this recording, the national non-facility price is about $160. In the comments section, I did include some helpful reminders when conducting the Medicare annual wellness visit. And again, it's important to bill for the right type of Medicare annual wellness visit, depending on when a patient's Part B coverage began and when their last annual wellness visit occurred. In the second row, you'll see the code G0439, which is associated with subsequent Medicare annual wellness visits. That is, Medicare annual wellness visits that occur 12 months after the last one. And providers, again, can use this code to bill for that particular service. In the third and fourth rows of this table, I've identified advanced care planning CPT codes. Keep in mind that, again, advanced care planning, while not required, can be completed as part of the Medicare annual wellness visit. If the annual wellness visit is completed in conjunction with advanced care planning, then providers can bill for both the Medicare annual wellness visit and advanced care planning using a modifier 33. And if modifier 33 is used for both of these encounters, in that case, the patient generally is not subject to a cost-sharing amount for these services. And finally, we have the 99483 cognitive assessment / care plan code listed here. And I've listed this here just again to make the distinction between this very comprehensive cognitive assessment encounter or visit rather, which is different from the brief cognitive assessment that is required in order to complete the Medicare annual wellness visit. Feel free to use this slide as a reference, again, keeping in mind that these numbers may be subject to change and of course may vary depending on other factors, but not limited to a patient's original Medicare versus Medicare Advantage payments, as well as geographic location. The last thing I will add here too is that annual wellness visits can be billed with other E&M codes not listed on this table using modifiers, that is modifier 25. As an example, if a patient has a Medicare annual wellness visit and the provider during that same encounter addresses a patient's hypertension and diabetes, in that case, providers can bill for both the annual wellness visit and can bill for a return office visit and use modifier 25. In this case, though, the patient may be subject to a cost-sharing amount given that a level visit was provided to the patient on the day of the encounter, in addition to the Medicare annual wellness visit. So as we've mentioned before, the Medicare annual wellness visit is not a routine physical exam. The annual wellness visit is also not an E&M visit. However, as I just mentioned, an annual wellness visit can be billed concurrently with E&M services using a modifier 25, and in this case, patients may be subject to a cost-sharing amount. If that is not the case and only a Medicare annual wellness is completed for the patient on the day of service, then generally patients do not have to pay for a cost-sharing amount for the annual wellness visit alone. The other thing I will add here too, as I mentioned on the previous slide, is that if the Medicare annual wellness visit is completed in conjunction with advanced care planning and a modifier 33 is used, in that case, for that day of service, the patients do not have to pay a cost-sharing amount for the annual wellness visit and advanced care planning, again, if the modifier 33 is used. And as I mentioned previously, if any additional services are completed at the time of the Medicare annual wellness visit, this includes, like I mentioned earlier, additional E&M visits, labs, imaging. In those cases, patients may be subject to a cost-sharing amount. In terms of practical tips that one can follow to incorporate Medicare annual wellness visits into their practice, remember that for billings purposes, providers can bill for Medicare annual wellness visits, like I said, as a standalone service or with an E&M service and or with advanced care planning. It's also important for practices to identify patients who are eligible for Medicare annual wellness visits by utilizing the electronic medical record to indicate a patient's last annual wellness visit in their clinic schedule, or by having the practice schedule reminders for patients who are due for their annual wellness visits. Some electronic medical records may be designed to run reports and display the names of patients due for annual wellness visits, but other electronic medical records may differ. Ultimately, it can be helpful for practices to be proactive about identifying these patients who are due for these visits. With that said, if practices are not sure whether a patient had a prior annual wellness visit, this information can be obtainable through the HIPAA eligibility transaction system or through the provider call center interactive voice responses system. A few other tips that can be helpful when incorporating annual wellness visits into practice is to plan ahead. As mentioned earlier, it can be helpful to identify individuals who are eligible for their visits. And if you see a patient who's on your schedule to be seen, consider incorporating the annual wellness visit into that encounter if time permits. Remember that much of what is asked in standard office visits, such as updating medical history, family history, medications, really should be done anyway during routine office visits. And if you do decide that you want your patient to undergo an annual wellness visit, keep in mind that health risk assessments can be completed by the patient in the waiting room, for example, and or at a time in advance of the visit. If available, consider having other members of the interdisciplinary team contact the patient to complete the health risk assessments in advance of the visit or following a routine visit. There are studies too that have shown that medical student involvement, that is telehealth interactions reviewing the health risk assessment with an older adult prior to the annual wellness visit, has helped facilitate self-directed learning and increase student-patient rapport. In terms of common misconceptions, oftentimes we hear that providers feel the need to intervene on all positive screens during the annual wellness visits. This is not true. This is based solely at the provider's discretion. If there are any positive screens during the annual wellness visit that is evaluated or managed at the time of the visit, the provider should consider adding an additional E&M code to the annual wellness visit code using modifier 25 in order to be appropriately compensated for a more thorough evaluation of the positive screen. Providers can also schedule a close follow-up for these patients if a patient does screen positive. Is the annual wellness visit the same as an annual physical exam? No, no, no. The annual wellness visit is not a routine physical exam. In fact, Medicare statute prohibits Medicare from covering routine physical exams. Bullet point 3, patients may also have the expectation that any lab tests ordered during the Medicare annual wellness visit will be free of charge to them. This, in fact, is not true. While the Medicare annual wellness visit itself is generally not subject to cost-sharing amounts for the patient, costs may apply to any labs, tests, or procedures that the provider orders during the visit. Remember that the annual wellness visit is strictly a screening health risk assessment visit and does not include an in-depth evaluation and assessment of a patient's medical issues. Bullet point 4, providers must perform a full cognitive exam, such as a MOCA, for the health risk assessment. This is also not true. There is no specific test required for the cognitive screen, and there are other common, oftentimes briefer assessments that may be used, such as mini-cog or a clock draw to fulfill this requirement. Bullet point 5, only a provider can ask for the annual wellness visit questions or health risk assessment. Again, this is not true. As mentioned previously, the health risk assessment can be done independently by the patient or administered by a non-physician member of the interdisciplinary team. To summarize, Medicare annual wellness visits are helpful to complete for older adult patients, as it does provide a framework to screen for geriatric syndromes, and it allows for counseling and creation of a preventive plan moving forward. Remember, the purpose of the Medicare annual wellness visit is to screen for issues, not to evaluate or manage specific medical complaints. If a provider needs to evaluate or manage specific medical issues in greater detail, providers can bill this as an additional service on top of the annual wellness visit using modifier 25. And finally, consider utilizing members of the interdisciplinary team to assist with scheduling dedicated Medicare annual wellness visits and assist with completing the health risk assessment. It can also be helpful for patients to use the electronic medical record, including the use of flow sheets and templates to automate the creation of the patient's personalized prevention plan, as well as help with provider documentation of the visit. Here are a list of some of the resources used in planning for this presentation. And we want to thank you for your attention during this presentation. But before we end, we do want to allow an opportunity for you to test your knowledge with a question based on the content we provided. So for this particular test question, all of the following are true for the Medicare annual wellness visit, except which of the following? A, Medicare covers an annual wellness visit for beneficiaries who are no longer within 12 months after the beneficiary's eligibility date for Medicare Part B benefits. B, Medicare covers an annual wellness visit for beneficiaries who have not received an IPPE or annual wellness visit within the past 12 months. C, Medicare covers a routine physical exam as part of the annual wellness visit. And D, evaluation and management, E&M services, can be provided in addition to the annual wellness visit on the same day. I will give you a few seconds to think about the answer to this question. So the correct answer, that is the wrong statement listed here, is C. In general, Medicare does not cover routine physical exams. Furthermore, the annual wellness visit is not a routine physical exam, but a visit that allows patients to create or update a personalized prevention plan. It was a pleasure presenting this information to you. We hope you're a bit more comfortable in incorporating Medicare annual wellness visits in your practice, and it was such a pleasure being able to share this information with you today. Thank you so much.